In this video, we are going to learn about the special tests for the shoulder joint. For convenience, this video is divided into 4 parts. Tests for instability, tests for tendon and muscle pathology, tests to identify labral tear, and tests for impingement. First test is called as the Hawkins-Kennedy Test. The purpose of this test is to identify an impingement of the supraspinatus tendon. The patient's arm is taken into 90 degrees of flexion with elbow also roughly 90 degrees flexed. Now, the therapist will hold the forearm of the patient while stabilizing the shoulder and forcefully medially rotate the arm. A positive test indicates pain on the medial rotation movement. The next test is called as the Neers test. This test is used to identify overuse injury of the supraspinatus tendon and sometimes even identifies overuse injury of the biceps tendon. The therapist will passively and forcefully medially rotate the arm at the same time fully flex the arm in scapula plane. A positive test is indicated when the patient's face shows pain. Next test is called as the posterior impingement test. This test is used to identify rotator cuff impingement primarily in overhead athletes. Since the patient will be in supine at the edge of the bed, the therapist will passively abduct the patient's arm to 90 to 110 degrees and then extend the shoulder to around 10 degrees, and after that maximally laterally rotate the arm in this position. This test is considered positive if a localized pain is elicited in the posterior part of the shoulder. The first test is called as the Yergasons test. The purpose of this test is to check the ability of the transverse humeral ligament to hold the biceps tendon in the bicipital groove. The test is performed in sitting or standing position. The patient's elbow is flexed to 90 degrees while supported at the side of the thorax and the forearm is pronated. Now the patient is asked to resist supination and lateral rotation movement against the examiner's resistance. At the same time, with the other hand, the therapist will palpate at the bicipital groove. Perform the movement. The test is considered positive under 2 circumstances. The tendon will feel popped out of the groove if the transverse humeral ligament is damaged. Second, if the tenderness is only in the bicipital groove alone without any dislocation. The next test is called as the Speeds test. The purpose of this test is to identify bicipital paratendonitis or tendinosis. The test is performed either in sitting or standing. The patient's arm will be by the side of the body and the elbow will be fully extended with the forearm in pronation. Now, the patient is asked to perform a forward flexion movement against the resistance provided by the therapist. Now, the same movement is performed in supination. The test is considered positive if there is increased tenderness over the bicipital groove, especially when the arm is supinated. Between the Speeds test and Yergasons test to identify for bicipital paratendonitis or tendinosis, the Speeds test is considered more effective because in this test, the bone glides over more part of the tendon. Hence, it is considered more effective than the Yergasons test. The next test is called as the drop arm test. This is also known as the Codman's test. The purpose of this test is to identify a tear in the rotator cuff complex. In this test, the therapist will passively and slowly abduct the arm of the patient to 90 degrees, and in this position, the patient is asked to slowly lower the arm in the same direction. Now you have to lower your arm slowly. This test is considered positive under two circumstances. The patient is unable to return the arm to the side slowly. The patient has severe pain while attempting to do so. The next test is called as the empty can test. This is also known as the Jobe's test. The purpose of this test is to identify a tear in the supraspinatus tendon or muscle or a neuropathy of the suprascapular nerve. For this test, the examiner passively abducts the arm to 90 degrees with neutral shoulder rotation. And in this position, the examiner asks the patient to abduct his arm further against the resistance provided by the examiner. Now, the same test is repeated with maximum medial rotation of the shoulder such that the thumbs are pointing downwards, and the same movement is performed by the patient. This test is considered positive when there is pain on performing the movement. The patient is unable to perform the movement due to weakness. The next test is called as the lift-off sign. The purpose of this test is to identify a lesion in the subscapularis muscle. For this test, the patient himself places his hand over the back pocket or against the mid-lumbar spine. Now, the patient is asked to lift his arm away from the back. The test is considered positive when the patient is unable to lift the hand away from the back. The test is considered positive if the patient is unable to lift his palm away from the body. The next test is called as the belly press test, also called as the Napoleon test or abdominal compression test. The purpose of this test is to identify a tear in the subscapularis muscle. This test is indicated if the patient cannot medially rotate the shoulder enough to take the hand back in order to perform the lift-off test. For this test, the therapist or the examiner places a hand over the abdomen of the patient just below the xiphi sternum, and the patient is asked to place the testing arm over the hand of the therapist. Now the patient is asked to press his hand into his abdomen, and the therapist identifies how much pressure the patient is applying throughout the movement. The test is considered positive if the patient is unable to maintain the pressure on the examiner's hand while moving the elbow forward, or posteriorly flexes the wrist or extends the shoulder. The next test is called as the bear hug test. The purpose of this test is to identify weakness of the subscapularis muscle. So for this test, the patient will take the testing arm towards the opposite shoulder with the elbow in front of the body. Now, the therapist or the examiner will apply a laterally directed force against which the patient has to flex his arm. With the other hand, the therapist will stabilize the elbow of the patient. A positive test is indicated when the patient is unable to maintain the pressure throughout the range. The first test is called as the Clunks test. The purpose of this test is to identify a slap lesion. For this, the patient will be in supine position. So one hand of the therapist will be made into a fist and will be placed directly over the posterior aspect of the humerus. Now, with the other hand, the therapist will hold the humerus of the patient distally and maximally abduct the arm. Now, in maximal abduction position, the hand placed under the humerus of the patient, the examiner gives an anterior glide to the humerus with this hand. The positive test is indicated when there is a clunk or a grinding sound present with movement. The next test is called as the slap prehension test. The purpose of this test is to identify a slap lesion. For this test, the patient's arm is abducted to 90 degrees And first, the forearm is pronated such that the arm is medially rotated and the thumb is pointing downwards. Now, in this position, the patient is asked to horizontally adduct the arm. Now, coming to the starting position, the same is repeated with the arm in full supination such that the arm is in lateral rotation. Positive test indicates when the patient feels pain while performing the movement in pronation, but the pain decreases or disappears with supination. The first test is called as anterior drawer test. The purpose of this test is to test for any instability in the testing arm. For this test, the therapist passively abducts the patient's arm to around 90 to 110 degrees and forward flexes the arm to around 20 degrees and then laterally rotates the arm to the maximal. Now, the therapist will stabilize this arm, and with the other hand, the therapist will place the middle and the index finger of his hand over the spine of the scapula of the patient, while the thumb of this hand goes over the coracoid process. Now, with the middle and the index finger, the therapist will give a forward push to the spine of the scapula, and at the same time, with the thumb pushing the coracoid process backward. Now, with the other hand that is stabilizing the arm, the therapist will give a traction force in the flexion direction while maintaining the pressure with the other hand. A positive test is indicated when the movement is accompanied by a click or if there is apprehension by the patient. The next test is called as the posterior drawer test. The purpose of this test is to test for shoulder instability. The examiner will flex the patient's arm passively and with one hand stabilize the forearm of the patient while the other hand stabilizes the wrist of the patient. Now, with this hand, the patient will apply a horizontal adduction and medial rotation force to the arm of the patient, while the other hand gives an axial load to the arm. The positive test is indicated when there is a look of apprehension on the patient's face or if there is pain or reproduction of symptoms. Next is the sulcus sign. The purpose of this test is to see for inferior shoulder instability. For this test, the therapist will passively abduct the patient's arm to around 20 to 50 degrees and hold the forearm of the patient. Now, while with the other hand, the therapist will stabilize the shoulder of the patient and the testing hand will pull the patient's arm in abduction. Positive test indicates a presence of a sulcus on distraction along with presence of symptoms of pain, ache or the shoulder not feeling right. The next test is called as the Dugas test. The purpose of this test is to detect for an unreduced anterior shoulder dislocation. So for this test, the patient is asked to place the testing extremity or the testing arm over the opposite shoulder. Now the patient is asked to lower the elbow of the testing arm towards the chest.